European Commission, governmental bodies, academic experts from major international research institutes and universities, and industry professionals. If you are interested in networking with a prestigious audience, publishing your scientific research, spotlighting your company, or staying at the forefront of the latest breakthroughs in science and digital transformation, the MDTWeek 2024 is an exceptional opportunity not to be missed. Madeira Digital Transformation Week, setting the scene for a human-centric vision in a digital society. Be part of the transformation. Register now and shape the future with us. Welcome to Madeira Digital Transformation Week, where the future meets tradition in the heart of the Atlantic. MDTWeek will host a convergence of innovation and a human-centric vision in a rapidly evolving digital society. Join us as we bring together 5 significant events under one umbrella, creating a melting pot of ideas, technology, and transformative experiences. Seize networking and collaboration opportunities, expecting over 400 participants, including representatives from the European Commission, governmental bodies, academic experts from major international research institutes and universities, and industry professionals. If you are interested in networking with a prestigious audience, publishing your scientific research, spotlighting your company, or staying at the forefront of the latest breakthroughs in science and digital transformation, the MDTWeek 2024 is an exceptional opportunity not to be missed. Madeira Digital Transformation Week, setting the scene for a human-centric vision in a digital society. Be part of the transformation. Register now and shape the future with us. Welcome to Madeira Digital Transformation Week, where the future meets tradition in the heart of the Atlantic. MDTWeek will host a convergence of innovation and a human-centric vision in a rapidly evolving digital society. Join us as we bring together 5 significant events under one umbrella, creating a melting pot of ideas, technology, and transformative experiences. Seize networking and collaboration opportunities, expecting over 400 participants, including representatives from the European Commission, governmental bodies, academic experts from major international research institutes and universities, and industry professionals. If you are interested in networking with a prestigious audience, publishing your scientific research, spotlighting your company, or staying at the forefront of the latest breakthroughs in science and digital transformation, the MDTWeek 2024 is an exceptional opportunity not to be missed. Madeira Digital Transformation Week, setting the scene for a human-centric vision in a digital society. Be part of the transformation. Register now and shape the future with us. Welcome to Madeira Digital Transformation Week, where the future meets tradition in the heart of the Atlantic. MDTWeek will host a convergence of innovation and a human-centric vision in a rapidly evolving digital society. Join us as we bring together 5 significant events under one umbrella, creating a melting pot of ideas, technology, and transformative experiences. Seize networking and collaboration opportunities, expecting over 400 participants, including representatives from the European Commission, governmental bodies, academic experts from major international research institutes and universities, and industry professionals. If you are interested in networking with a prestigious audience, publishing your scientific research, spotlighting your company, or staying at the forefront of the latest breakthroughs in science and digital transformation, the MDTWeek 2024 is an exceptional opportunity not to be missed. Madeira Digital Transformation Week, setting the scene for a human-centric vision in a digital society. Be part of the transformation. Register now and shape the future with us. Welcome to Madeira Digital Transformation Week, where the future meets tradition in the heart of the Atlantic. MDTWeek will host a convergence of innovation and a human-centric vision in a rapidly evolving digital society. Join us as we bring together 5 significant events under one umbrella, creating a melting pot of ideas, technology, and transformative experiences. Seize networking and collaboration opportunities, expecting over 400 participants, including representatives from the European Commission, governmental bodies, academic experts from major international research institutes and universities, and industry professionals. If you are interested in networking with a prestigious audience, publishing your scientific research, spotlighting your company, or staying at the forefront of the latest breakthroughs in science and digital transformation, the MDTWeek 2024 is an exceptional opportunity not to be missed. Madeira Digital Transformation Week, setting the scene for a human-centric vision in a digital society. Be part of the transformation. Register now and shape the future with us. Welcome to Madeira Digital Transformation Week, where the future meets tradition in the heart of the Atlantic. MDTWeek will host a convergence of innovation and a human-centric vision in a rapidly evolving digital society. Join us as we bring together 5 significant events under one umbrella, creating a melting pot of ideas, technology, and transformative experiences. Seize networking and collaboration opportunities, expecting over 400 participants, including representatives from the European Commission, governmental bodies, academic experts from major international research institutes and universities, and industry professionals. If you are interested in networking with a prestigious audience, publishing your scientific research, spotlighting your company, or staying at the forefront of the latest breakthroughs in science and digital transformation, the MDTWeek 2024 is an exceptional opportunity not to be missed. Madeira Digital Transformation Week, setting the scene for a human-centric vision in a digital society. Be part of the transformation. Register now and shape the future with us. Welcome to Madeira Digital Transformation Week, where the future meets tradition in the heart of the Atlantic. MDTWeek will host a convergence of innovation and a human-centric vision in a rapidly evolving digital society. Join us as we bring together 5 significant events under one umbrella, creating a melting pot of ideas, technology, and transformative experiences. Seize networking and collaboration opportunities, expecting over 400 participants, including representatives from the European Commission, governmental bodies, academic experts from major international research institutes and universities, and industry professionals. If you are interested in networking with a prestigious audience, publishing your scientific research, spotlighting your company, or staying at the forefront of the latest breakthroughs in science and digital transformation, the MDTWeek 2024 is an exceptional opportunity not to be missed. Madeira Digital Transformation Week, setting the scene for a human-centric vision in a digital society. Be part of the transformation. Register now and shape the future with us. Welcome to Madeira Digital Transformation Week, where the future meets tradition in the heart of the Atlantic. MDTWeek will host a convergence of innovation and a human-centric vision in a rapidly evolving digital society. Join us as we bring together 5 significant events under one umbrella, creating a melting pot of ideas, technology, and transformative experiences. Seize networking and collaboration opportunities, expecting over 400 participants, including representatives from the European Commission, governmental bodies, academic experts from major international research institutes and universities, and industry professionals. If you are interested in networking with a prestigious audience, publishing your scientific research, spotlighting your company, or staying at the forefront of the latest breakthroughs in science and digital transformation, the MDTWeek 2024 is an exceptional opportunity not to be missed. Madeira Digital Transformation Week, setting the scene for a human-centric vision in a digital society. Be part of the transformation. Register now and shape the future with us. Welcome to Madeira Digital Transformation Week, where the future meets tradition in the heart of the Atlantic. MDTWeek will host a convergence of innovation and a human-centric vision in a rapidly evolving digital society. Join us as we bring together 5 significant events under one umbrella, creating a melting pot of ideas, technology, and transformative experiences. Seize networking and collaboration opportunities, expecting over 400 participants, including representatives from the European Commission, governmental bodies, academic experts from major international research institutes and universities, and industry professionals. If you are interested in networking with a prestigious audience, publishing your scientific research, spotlighting your company, or staying at the forefront of the latest breakthroughs in science and digital transformation, the MDTWeek 2024 is an exceptional opportunity not to be missed. Madeira Digital Transformation Week, setting the scene for a human-centric vision in a digital society. Be part of the transformation. Register now and shape the future with us. Welcome to Madeira Digital Transformation Week, where the future meets tradition in the heart of the Atlantic. MDTWeek will
So, good morning, everybody, and welcome to the third day of our technical program for Madeira Digital Transformation Week. I hope you had a wonderful evening yesterday and that you had the opportunity to get some rest, because we have ahead of us a very intense day. So today will be mostly dedicated to digital health, and for that we will have our welcome message from the Regional Secretary of Health and Civil Protection from Madeira, Dr. Pedro Ramos. We will be following that the keynote session with Professor Dimitris Fotiadis from the University of Ioannina, and then from Professor Georg Dorfner from the Institute of Artificial Intelligence from the Medical University of Vienna. We also will have communication from Dr. Schuyler Rene from the European Commission, who unfortunately could not join us, but had the kindness to send us a video message, which we will also share with you. I would like to highlight for today the EIT Health Morning Talks, which will be taking place in this room at 11. So this is a bit different from the other days of the event. And so I'm highlighting this for the ones who have interest and want to join. Of course, at 11, we will also have the other parallel sessions, so I invite you also to explore the program and join the ones that you see with more interest for your own work. At 2 p.m., we will have our main panel on building a digital ecosystem for resilient, healthy, and independent EU citizens, which will be moderated by Professor Tal Sofer from the Tel Aviv University, with a set of very distinguished participants and panelists, which I also invite you to attend. And please don't miss our closing banquet at 7:45 p.m. At the Casino Park Hotel. It will be, let's say, the highest point of all the events that we have been having this week, for which also I would like to ask you to be quite formal in your dressing, because again, it's our main event. So I would like now to welcome the Secretary of Civil Protection and Health. So, Dr. Pedro Ramos, please.
Good morning to everyone. It's an honor and a real pleasure to be invited to Madeira Digital Transformation Week. And so I give all of you a very warm welcome to our island, and I hope and wish that you have a good experience in this pearl of the Atlantic Ocean. Special greetings to our Professor Ricardo Jardim Gonçalves, a special friend of Madeira, and his commitment with his team, Carlos and Maria Marques and the others, to bring for the second time this Digital Transformation Week in Madeira. This will be a shared organization between the regional government of Madeira, through Health Secretary and Tourism Secretary, with Uninova, with IDEA, with the Institute of Development and Technology, with Innovation, with the Advanced Technology for Humanity, with the Technology and Engineering Management Society, with the European Institute of Innovation and Technology, with the Nova University and Minho University. This pearl of the Atlantic wants to follow all the digital transformation that is going on in the world and wants to apply in every area of Madeira. We are an island with 250,000 people, with a PIB of 7 billion euros, with a large investment in tourism and technology enterprise, and with a number of visitors annual of 2 million people, with 11 million beds. We are in the middle of the Atlantic Ocean, and we want to lead the Macaronesia region that involves Madeira, Azores, Canary Islands, and Cape Verde. It's 3 million people that we want to assure a different DNA, that all of them has the opportunity to reach good health and well-being, good protection in public health, achieve sustainability with increase and more solidarity, efficiency control of non-communicable disease, good system of preventable disease in the cycle of life, and more important, with quality longevity, with more life to the extra years, with education, differentiation, investigation, and innovation. We want to fulfill all the last recommendations of the World Health Organization. In 2022, universal cover in the health system. In 2023, One Health, a new environment with a perfect equilibrium between human health, animal health, and vegetable health. And in 2024, My Health, My Right, and probably My Duty. We are with a strong commitment to reach these goals in our population, reduce morbidity and mortality, and ensure more security and quality in our lives. Digital transformation, it's not the future. It's the present, and we need to follow. In Madeira, we are trying to run in the health system this digital transformation since a few years ago with Uninova and Nova Medical School, and also other players. Our health system has 3 public hospitals, 7 private hospitals, 47 primary care centers, 6,000 health professionals, 2,300 nurses, 1,200 doctors, 1,500 technicians of health, 1,700 technicians administrative. We have 100% cover in primary care center. Our budget is 450,000 euros. We have all the specialties. We do here in Madeira all the procedures except transplants. But our health system is already an Atlantic health system. We treat stroke from the Azores Island. We operate cardiac surgery from the Azores. We treat gynecologic and oncology problems. We treat neonatology. We treat neuroradiology intervention. Our collaboration with Cape Verde in education programs in the area of basic life support and advanced life support, and some investigation with Canary Island. Our goals for this Atlantic health system have one direction: health development in Micronesia. One compromise: health for everyone, everywhere, in every moment in Micronesia. One objective: health and well-being for everywhere, for all. And not but the least, good outcomes: less morbidity, less mortality, more public health, more integration of care. Since 2019 that we begin this digital transformation in our health system, focusing on innovation, more investigation, artificial intelligence and machine learning, data science, virtual reality, augmented reality, standard reality, and also big data to improve our security and quality management. We believe that this is an excellent opportunity to start, and we start, the organization of our health system after the pandemic situation. Catastrophes that are very negative when they occur, but they also represent an opportunity to change from what we learn about them, says Hans Klopp from the startup North Face in America. And that's what we are doing since 2019. Nevertheless, with a superficial beginning since 1992, when we start the digitalization of our system in CESARAM. It's a long history with almost 20 years with ITMC system, and after with CESARAM, and recently we won the European contest of ICE eHealth Award, interoperability of data among 19 projects, European projects from 10 European countries. The system already had, since 1992, 560,000 clinical files and 57.4 million of data related with those clinical files. This award takes us to the past with the message that we need to respect the past in Madeira, in our health system, what we have done. Gave, in the same time, the opportunity to stabilize and consolidate the present, what we are doing, and offers the chance to promote a new future in health system with digital transformation in Madeira, what we need to do in the next years. The summit has this goal also, to contribute with our partners that already know what we are doing in this field, to continue digital transformation in health in Madeira, in our health system. With this summit, we will try to improve innovation in communication, innovation to assess, innovation to diagnose, innovation to treat, innovation in artificial intelligence, innovation in data science and new algorithms, robotization, ambulatory, clinical governance, secondary prevention with screenings, health literacy. This will be the new image of health system of Madeira, ready to click when you need to decide, ready through a click when you need help, ready always when you need faster and quickly some data. As I told you, this is the new road for Madeira. After the walking levadas 600 years ago, the highways in the 20th century, we will have in the 21st century the digital transformation with extraordinary impact in our healthcare system. This road, we cannot do it alone. We need partners, public, private, universities, institutes, enterprise, startup, regional, national, and international. This is a road that Government of Madeira and other players are building since 2019. This is building new bridges to knowledge, building new roads to the future, building new cliques. Digital technology, it's a promise for better care delivery. We know that since 1992, and because of that, we developed not only platform and application to the patient, but also to the doctor, nurse, emergency department, prescription, to connect with the pre-hospital system, to pharmacy and drugs, and for visitors. We are more connected. After the pandemic, we learned that we need to change all the system. Health must be digital with telehealth, artificial intelligence, and data centers. Data will be the most powerful weapon that health will have in the future. With data, we can improve our medical assistant, we can create new dashboards helping the decision, we can create new algorithms to support decision, and we'll have more time to humanization, our service, our activities. We are creating a new hub to promote and protect health and to the right prevention of disease. This new investigation has three axes: improve healthcare work conditions, improve satisfaction and humanization for our patients, try to achieve and build new management for the health system to become more efficiency and reduce costs, loss and waste in the system. Madeira already has a plan for the future. Digital Transformation Strategic Plan 2030. Priorities are development of a new investigation center, development of the digital economy, scientific and technological development, make the new hospital a reference in the digital transformation, build new startups and new enterprise, creation and advanced computer center for artificial intelligence. We are glad at this moment because we already have more than 100 universities and institutes and more than 500 students, more than 100 investigators, more than 250 research groups working with us. The future is in next door. We want to create a new concept for our health system. For the new hospital in Madeira, for the new generation, it's the Kiwi hospital. Knowledgeable hospital we need to increasingly operate and require the highest degrees of science and technology, intelligent use of artificial intelligence in basic medicine, procedure, robot, imaging, genetics, but also in intelligent hospital management. Wise, only people can be wise. Wisdom is still a human prerogative, yet trust and ethics are needed at the deeper and transverse levels of the organization. Trust and digital ethics reinforcing structures and processes will need to become their core competencies. And finally, interoperability, a term associated with IT, creation of standards and big data space for exploiting the value of secondary and tertiary data. This will be our future present. That's the future in the Atlantic with digital transformation in health and healthcare, a new ecosystem with new tools, more digital, more AI, more augmented reality, more telehealth, more data science, more data analytics. But digital is also about inclusion. You have a new objective, more safety, more security, more quality of care, new environment. Digital health system needs to have, first of all, healthcare transformation. Second, significant investment in seeking and need for physical interaction. Telehealth is the new health. Third, security of data, privacy and interoperability. And fourth, motivation. Rethinking healthcare system worldwide was already need. 2020 gave us as a motivation. We have 600 years of history. Through them, we cross and face several cycles. Now we have another cycle. After the cereal cycles, the white gold cycles, the wine cycle, the tourism cycle, appears the knowledge cycle. Now we are facing the innovation digital cycle. For our success, we count and believe that it is essential a truly involvement and participation of the health professionals in the decision-making healthcare system. After the pandemic situation, we said that things will be different and we want to accomplish those issues. We want to do always with value. And so, protection, promotion, and prevention are essentials. Regional policies are present since more than 40 years. One Health is our goal. Quality certificate and accreditation is priority for us, Madeira Health System. Security and quality increase the efficiency of our system. And so, sustainability is priority for us in Madeira also. For the future, we know that we need to have hospital at home, interoperability, robotization, home care, ambulatory surgery, endoscopic surgery. Our digital transformation started 30 years ago, as I said to you. Several platforms and applications we already made in these last 30 years. Because of the pandemic, we increased the appearance of new applications and platforms. We do Innova, the regional government of Madeira and our secretary, in collaboration with the Institute of Innova and the Institute of IDEA, are developing research and innovation projects in the autonomous region of Madeira. I can emphasize the Smart Bear project, the XR project, the ICU for COVID, the Smart for Health. I would like to say that we also have a new program that is Digital Skills for Health that will design and deliver an international master program in digital health addressing key applications like artificial intelligence, cybersecurity, data robotics, and Internet of Things, all the themes of this summit. In the administration, these applications appear in all sections of our healthcare system, in CESARAM, in the Institute of Administration of Health, the Health Direction of Madeira, Civil Protection, and in direction of the longevity. Finally, I will say that in our civil protection, we already have some programs like CIRESP, like the ProCiv Madeira, a GPS for people, and like SADO, a support system to decision in emergency care. As you see, lots of work have been done, and I want to thank all of the team leaders and professionals that were involved on those implementation. To finalize, I would like to emphasize the importance of these meetings to consolidate this project in Madeira, and so I would like to thank all the participants present here following this summit, and finally, I would like to give special thanks to Professor Ricardo Jardim Gonçalves and the other players and his team, and important players, strategic players for us, Government of Madeira, to build this digital transformation in healthcare system. Professor Ricardo, let's continue to make the difference in the Atlantic digital health system. Thank you all. Enjoy Madeira.
Sylar Rinne currently works at the director.
Thank you very much for your message, and for sure we accept the challenge. We will now proceed with the rest of the session. As I said, the first keynote is Dr. Sylar Rinne from the European Commission. She's not here, so we will just move on with the communication that she sent us.
Sylar Rinne currently works at the Directorate General for Communications, Networks, Content and Technology, DG Connect, of the European Commission. She is the head of sector for policy in the unit e-health, well-being and aging. This unit's main mission is to support innovative digital health solutions and services that foster the delivery of high-quality and efficient digital health and care services and products, enabling the empowerment of citizens in managing their own health. Sylar has previously worked on the research and innovation activities of the Data Policy and Innovation Unit in DG Connect and as a translator and terminologist in DG Translation of the Commission.
Thank you very much for having invited me to give this speech to you today, and I'm very sorry that I was not able to be there in person today. I'm going to talk about digital transformation of healthcare in particular from the perspective of the European Commission and DG Connect, Directorate General for Communication Networks, Content and Technologies. The European Commission has been working with Member States to drive the twin, green and digital transition for the benefit of people, economy and society. Healthcare is a key sector in this agenda. Healthcare systems globally are facing unprecedented challenges, such as population aging, rise in chronic diseases, and exponential rise in healthcare costs. In this context, digital technologies such as generative artificial intelligence hold the potential to revolutionize healthcare. These technologies can improve the quality and accessibility of care, promote better health outcomes through personalized treatments, and reduce healthcare costs. Our work in the European Commission is guided by the ambitious targets of the Digital Decade Policy Programme, which has been shaped together with Member States. This programme will ensure that by 2030, everyone in the EU will be able to access their electronic health records online. Over the past 5 years, the Commission has put forward the necessary building blocks to make this a reality and to achieve the digital transformation of healthcare. The European Health Data Space Regulation, for example, and also the Data Act, the Artificial Intelligence Act, cybersecurity packages, and the EU Digital Identity Wallet framework have been really the cornerstones for the next steps of digital transformation. 678 million euros approximately was allocated to digital health research, innovation and deployment actions under the Horizon Europe and Digital Europe programs. The European Health Data Space will enhance the availability of high-quality health data to researchers and innovators, enabling the discovery of groundbreaking treatments and novel health solutions. The Commission is also supporting EU-wide health data infrastructures in the field of cancer imaging, genomics, and virtual human twins modeling. These infrastructures will allow clinicians, researchers, and innovators in the EU to access different types of health data, which will fuel into AI-driven innovation and open the door to discovery of new life-saving treatments and tools. Digital technologies can help us tackle the demographic transition, fostering healthy living for people of all ages. The Horizon Europe funding program call on Silver Deal, for example, which had a budget of 40 million euros, is coming now with projects that are developing evidence-based models and tools for prevention and digital solutions for person-centered care. Looking ahead, we must prioritize and scale up investments to accelerate the digitalization of health systems using technologies like AI, robotics, telemedicine, and biotechnologies. We will capitalize on our world-leading supercomputing infrastructures and on our robust health data infrastructures. That is the core of our innovation package that the Commission has published in January this year. This package is about promoting AI, especially generative AI, across key sectors, including healthcare. The Commission has also issued a communication on boosting biotechnology and biomanufacturing, supporting the use of uptake of generative AI in these sectors related to health as well. It is also fundamental to facilitate the uptake of digital health innovations by both clinicians and patients, bridging the last mile of bringing these solutions to clinics. Strengthening our IT workforce skills, along with digital health literacy of healthcare professionals and patients, are really important aspects as well, because these will enable us to fully harness the benefits of digital health technologies and to enhance individual health and economic competitiveness. Finally, we must continue to collaborate on the digital transformation of healthcare systems to ensure continued increase in access to and availability of digital health services to all citizens, thereby contributing also to the aims of the European Health Data Space. With this, I thank you for your attention and I wish you a very fruitful and pleasant day of summit. Thank you very much.
Professor Dimitrios Foshardis received his diploma degree in chemical engineering from the National Technical University of Athens in 1985, and his PhD.
So please welcome now Professor Dimitris Fotiadis from University of Ioannina.
Professor Dimitrios Foshardis received his diploma degree in chemical engineering from the National Technical University of Athens in 1985, and his PhD degree in chemical engineering and materials science from the University of Minnesota Minneapolis in 1990. He is currently a professor of biomedical engineering in the Department of Materials Science and Engineering at the University of Ioannina, where he is also the director of the Unit of Medical Technology and Intelligent Information Systems. Furthermore, he is also an affiliated member of Foundation for Research and Technology HELIS, Institute of Molecular Biology and Biotechnology, Department of Biomedical Research. He was a visiting researcher at the RWTH in Aiken and at the Massachusetts Institute of Technology in Boston. He has coordinated and participated in more than 200 R&D funded projects. He is the author or co-author of more than 250 papers in scientific journals, 450 papers in peer-reviewed conference proceedings, and more than 50 chapters in books. He is also the editor or co-editor of 35 books. His work has received more than 12,000 citations. He is IEEE.
It's too much. I mean, thank you very much, Maria, but I think that going in all those details is not useful today. Good morning to everybody. It is a great pleasure to come here. Thanks, Ricardo, for inviting me. Thanks also to the government of Madeira for supporting this event. And thanks to you for being here in this wonderful event. We are starting today's discussion going deeply into what the region of Madeira is doing about digital health, let's say, in the broader sense. And then we have seen what the European Commission is supporting, you know, in digital health. Actually, there is something where those two talks cross, or there are other things, but one of those is AI, and this is artificial intelligence. And actually, I'm here because I would like to go and to spot something which is very important in digital health in AI, which is trust. So somehow we have to address this very important issue. Of course, I'm an engineer, I'm a researcher, and I see that from not from the social point of view, but I see the other point of view, and we have many problems to solve. Actually, when we're speaking about trust, we're not speaking only about digital health, but there are other domains where we have to see trust. And this is how trust is treated today by certain regulations and certain initiatives. It's not treated only for digital health. Starting today, my talk, I would like, you know, to understand what is, you know, the global impact of AI, and also to understand what the risks behind that. Because when we're speaking about trust, mainly we're speaking about risks. Be careful with this link that I'm making. Then I will speak about trustworthy AI. I will present a few slides about AI Act and see what the AI Act, how AI Act regulates this field, and how AI Act treats the risks. And then I will present two frameworks that are mostly unknown to you. One is coming from the other side of the Atlantic, is the NIST framework to handle the risks. And also we have another framework, which is the NISA framework to treat the risks. And then I will present some work that we're doing in FAITH, which is a very large initiative in 7 sectors in the European Union, and then to make some suggestions for the future. one of the things that I would like to start is that, you know, why do we need AI? Why it's needed today? And I say that we have AI can replace, enhance, or surpass sometimes what can be achieved with human cognitive abilities alone. And I think that this is a very focused statement, and actually it brings you the idea of trust from the beginning, because we don't like to have AI to change our lives or to create a lot of discussions about jobs, about productivity, about losing taxes, about risks. So somehow we have to protect the idea of AI, because as you understand from the previous speakers, AI plays a key role in the ongoing digital transformation. So those 2 points for the beginning. And actually, we can see that we have several numbers, because there is a very serious statement that was made before, that generative AI, a part of AI, a special, let's say, direction of AI, suggests activities which are counting up for up to 30% of current employee hours by 2030, and then beyond 2030, this will rise to more than 70%. Those numbers are very close to, you know, some numbers that we have today as predictions, and they are coming from different sectors about the creation of synthetic data. You know, one of the main problems that we have today, you know, in medical research and also with the European data space is that we have problems with ethics and the clinical trials. And we're looking to find other ways to replace those in silico clinical trials and so on. The numbers are same for the synthetic data. Today, 20% of the data that we are using in medicine comes from synthetic data. We predict around 2030 and something to have 70% coming from synthetic data to produce the same things, to do drug discovery and so on. Let's see what is the impact first of AI in different sectors on profits by industry. And you can see education, 84% is the highest number that I have there. Accommodation and food services, which is very important also for the region of Madeira, 74%, 71% in construction, 55% on healthcare. So you can see how we can benefit from that. And we have 3 very important statistics about AI. Which processes rely heavily on AI? This is the first one. How do organizations, leaders perceive AI? And then what are the top benefits of AI adoption? I will start with the last one because I would like to see the advantages on that. First of all, you know, 80% believes that it makes the work easier, and actually 75% believes that they can move to new ventures much easier. Then, if we will see how the organization and leaders perceive that, and this is, I think, the talk by Petro today, that they believe that AI and machine learning are game changers. They will like they will change the health system, the healthcare system. But also, if you see how the global AI ranked by revenue of use cases, you will see vehicular detection and avoidance, static image recognition, processing of patient data comes with 7.2 billion in that case. So those are very important questions for us. And if you see the early adopters, you will see that we're somehow, let's say, in between, let's say, what is done in China and United States. Germany and United Kingdom have very good numbers, followed by France in Europe, but you know China is the first. And then, you know, we have to make a let's say, a comparison what the overperformance thing for AI compared to the underperformance. And you can see that the overperformance believe by 90% that AI addresses privacy, security, and regulatory concerns, and then creation of standards and so on. I'm comparing those for the ROIs, and actually those are numbers that are coming from ESI through lab. And of course, if you can see the commitment curve that we have today, and we have to adopt in every sector, and also in the healthcare sector, the first is the contact with AI, then is awareness, the understanding, the positive perception of the application of AI, the experimentation in small scale in pilots, the adoption by large organization, the institutionalization, and then the internationalization. Actually, this makes, let's say, the plan that we have for AI. Of course, anytime we can see that we can have zero out of that because we might have negative perception of AI applications. And this creates problems. So at the bottom, and this is the time that you can see there, we have a different understanding, and sometimes we have to terminate AI programs because we have problems. For those that they don't know today, you know there are, by FDA, almost 600 medical devices approved having AI. Okay, there the adoption is much easier. If you go, you know, to the European Commission and under the new MDR, this becomes much more difficult. And there are several concerns around, first, ethical risks, safety concerns, lack of explainability and transparency that I will explain later, elimination of jobs, using AI to manipulate people's thinking and behavior, and also potential bias of AI algorithms. So I am giving you here briefly the recognized risks that we have. And really we have to understand that frontrunners, followers, and starters perceive in a different way the risks. So on the right, you can see how they perceive that and the risks that we have. And of course, you know, we have somehow to categorize what we mean by, let's say, levels of concerns. There are some people that they think that, you know, we have banks in AI and they make those vulnerable to attacks. You know, this is very important thing, and today the European Commission addresses this through specific calls. Cyber attacks, stealing sensitive or proprietary data. Yesterday we had a talk here about data. Use of AI to automate tasks involved in executing cyber attacks. Stealing sensitive or proprietary data, again, for Australia, banks for UK and Canada, manipulation of cognitive and training data or algorithms. So you can see that the trust, and the numbers are very high, it's above 50% in some countries. They have a fear that we lost data, and also I can have someone who can interfere with my system. And of course, you know, when we're coming to the digital health, there are specific concerns because some people, they think, and especially for the European data space, that we're using the personal data without consent. Then the ethics of AI systems, and of course the potential job losses from AI-driven automation. And actually, you can see that those concerns make somehow this field to feel uncertain under those analyses. And actually, we have to identify those risks and understand for each model which are those risks. Because we have to promote fairness and equity, to protect privacy, to prevent job displacement, to ensure security, and to mitigate existing risks. And on the left, you can see several risks that we can identify, more than I presented before. So if you get an example of generative AI, of course you can understand that with generative AI, and everybody talks today about generative AI, we have content generation, summarization, analysis, image generation, extraction, and so on from generative AI, because I have spoken before about synthetic data. But the risks are related to privacy, to cybersecurity, fraud, IP infringement, hallucinations, and also ethical concerns. So this is a very good example of what happens in the health sector, and we understand that when we're using this generative AI, we have several risks. Again, a systematic approach is needed to identify risks and categorize the risks in several categories. And the proposed ones by McKinsey here are privacy, security, fairness, transparency and explainability, safety and performance, and third-party risks. And we have to analyze how we can reach those risks and how we can manage those risks. And of course, there are some mitigation measures that we can do. First of all is to establish legal frameworks for AI safety. This is what our AI Act is doing. To set the ethical standards for organization AI use within an organization, to integrate AI into the company culture responsibly, and of course to incorporate diverse perspectives in AI development. Those are solutions that we have to see, okay, point by point. And of course, you know, because we like to promote and to see how we can use wisely AI, we have to understand that we can do research, we can do business consultancy, board development, executive education, pro bono support, and regulation. So those are actions that are related, you know, to the AI governance that we have to present in the next. But before going to that, we have to understand what we mean by trustworthy AI. Because today, this is misunderstood sometimes. Of course, when we're speaking about trustworthy AI, we're speaking about development and deployment of artificial intelligence models in a manner that is ethical, reliable, it is designed to benefit and do not harm the individuals and society. This is the definition, but we have to go point by point to understand what I have on the right and understand how I can speak about trustworthy AI. Of course, on the left, you know, it's a very good example of the ecosystem that is involved, you know, in the healthcare system and the trustworthy AI. Because in the healthcare, we have to speak only about trustworthy AI. And the key principles are accountability, privacy and data governance, societal and environmental well-being, technical robustness and safety, human agency and oversight, diversity, non-discrimination and fairness, and transparency. Those are the key principles that underline the trustworthy systems. I'm starting, you know, from the first one, which is the robustness, the bottom one. Very important, because we understand that robustness is the ability of an algorithm to handle execution errors, erroneous inputs, or unseen data in a very nice way. So this is the first thing, because if you don't have that part, then you have problems, robustness. In the past, and actually in the papers that I'm receiving in the journal, they mean by robustness that I have an algorithm that I have to try in this data set, and if it applies to another algorithm. But it's not enough to cover robustness in that way. The second is generalization. Involves distilled knowledge from limited training data for accurate predictions. This is another thing that applies especially to healthcare and personalized medicine. I mean, in some cases, and especially for rare diseases, we have limited amount of data, but we have to generalize what the decisions are made by those tools. Then explainability. And of course, when in the healthcare system we're speaking about such systems, at the first place comes explainability, because the system should be used, especially deep learning system, should be used by the doctors. And we have two ways to address that, by design and the post hoc model explainability. Those are technical details, but are very useful to understand how we can do that. Then we have transparency, and we have to face that, and actually we'll present how we face that, in systems in healthcare. Various information about its creation needs to be disclosed, including design purposes, data sources, hardware requirements, configurations, working conditions, expected use, and system performance. Basically, that was the message from the European Commission, because this is the pipeline that they follow, because they like to have transparent AI models. And then we have the reproducibility, enabling swift implementation of new methods and preventive potential risks in an open cooperative ecosystem, and refers to data, methods, and experiments. And of course, we have fairness, and fairness is related to biases. And we have several biases which are related to data, to models, and also to procedures. So this is another important thing, and this is one of the most important risks that we have to address. And of course, privacy protection, because we like to avoid unauthorized use of data that can identify individuals or households. And this comes to the healthcare as a first need, and actually this is why we have the regulation, the GDPR. The basic principles are transparency, explanatory power, and actually full utilization under privacy and other concerns that we have. And then at some point, looking into all those risks, the European Commission trying to regulate AI. And actually we have the regulation, which is a part of a broader strategy to enhance Europe's technological leadership. But let's see if this is true. Because, for risks, AI Act speaks about minimal risk, limited risk, high risk, and unacceptable risk. So it ranks the risks. But of course, ranking the risks, we have to use, let's say, the approach that they suggest. So the approach that they suggest is risk-based. They are looking to safety and fundamental rights, to transparency obligations, to market surveillance, which is very important also for the healthcare applications, to the legal framework and the global impact. And those are the key aspects of AI Act. But again, I'm coming here because AI Act, provides a level of risks which is called unacceptable risk. So if you are developing a model, an AI model, and you can find the risks which are unacceptable, you cannot go to the market. Somehow AI Act, and this is what is discussed from the other side of the Atlantic, because they are looking to that in a very different way. They see that as a very strong regulation, and not only, but also limitation to the European, industry of medical devices. Because we're speaking here about software as a medical device, and actually we have to see how we're doing that. On the right, you can see the steps that we have to follow before placing something to the market. And actually this is regulated now. Of course, in the States, they have a different opinion on how they can do that. And what is allowed in the European Union, according, to the articles that we have in AI Act. And they say it's prohibited to have AI models used for social scoring and purposeful manipulation. And this is a very strict limitation. Of course, there are other high-risk material and models that we have also to protect ourselves. But let's see how the others, see on the AI risks. Because, the others do not see, the others, I mean the Americans, because this is the strong, let's say, community of AI tools today. This is where they're producing all the new tools. Okay, and they have prepared some frameworks, are non-regulatory organizations, but they propose some frameworks because they have to identify, protect, detect, respond, and recover from frameworks. And one of those frameworks is the NIST frameworks, which, addresses several things. And actually, there is a lot of discussion in the report by NIST on those issues. And to our opinion, is something that we have to follow also in Europe. Because they are proposing a risk management framework, which is based on the map, the measure, the management, and the governance of those risks. And actually, they classify the AI life cycle of several models into 5 key socio-technical dimensions that we have to see, but always they have the people and the planet in the middle. Because we're not speaking only about healthcare, but we're speaking about also the issue of One Health, which affects the health system. And actually, this is the roadmap that they're following. And there are many things that we have to do, but they have provided a new terminology which is called TEV, and you have to have that in mind: test, evaluate, validate, and verify. This is the new thing that comes, with our models. And actually, they see a trustworthy system, and I'm looking at the bottom, and safe, secure and resilient, explainable and interpretable, privacy-enhanced, fair, accountable and transparent, and of course, valid and reliable. And the life cycle that you can see here, it starts, looking in several dimensions, from application content, context, the data and the input, the model, the output, and also the people and the planet that I mentioned. And at the bottom, you can see the various activities that they have to see. But actually, you have to plan and design, you have to collect and process data, you have to build and use the models, you have to verify and validate, you have to deploy and use, you have to operate and monitor and use, and also to see the impact of the use of the system. And actually, they are introducing several standards, and actually, they are introducing what is called the AI bias that I promised you before to explain to you, because on one side, you have the human bias, which is analyzed on the left, but also you can see what is happening with the biases, the human biases, the observational bias, the availability bias, and also other biases that we have to introduce. Then we have the statistical and computational biases, like the sampling and selection, the automation biases, and also we have the systemic biases. But always at the bottom, we have, as a common denominator, the TEV, which is testing, evaluation, validation, and verification. And of course, they are proposing a machine learning, for a machine learning project, the life cycle, which includes several steps, from data collection, data cleaning, data pre-processing, model design, implementation, model training, model testing, optimization, model evaluation, model deployment, monitoring, and inference. This is the way that we are starting today to present artificial intelligence into students and to understand where we have to identify the risks. But on the other side, there is also a non-regulatory organization which comes from the side of Europe, which is called ENISA. And actually, ENISA is looking, in the same way, but they're looking, more technical to supervised learning, unsupervised learning, and enforced learning as the main domains, and they have identified several steps that we have to do in order to make those fully explainable, globally explainable or non-explainable models. So ENISA suggests that we have to categorize our models in these directions. And then, you know, they have identified, this is very useful, okay, for our models, what are the major cyber threats. Malware, web-based attacks, phishing, web application attacks, spam, identify theft, data breach, incident cheat, you know, a lot of other things that you have to see here. And actually, they suggest that there is a growing cyber attack surface that we have to protect ourselves, because we have more data, more users, more smartphone connections, more IP-connected devices, more network traffics, and actually they are giving the numbers, okay, that someone has to use that. And then, okay, there are some challenges when we are building the trustworthy AI systems, and those challenges is where we're trying to consider our work and research. And actually, the first one is to improve performance and reliability, to make fast and accurate data processing. You have heard about the supercomputers today in Europe, personalization and customization, and also specialization and assistance in specific domains. For us, the approach that we're following is we're building something which is called trustworthiness assessment framework. So you have a model, you provide the model, you provide the data, and then we can make an assessment. And this is a real tool that you need when you are going to the regulatory organizations, when we're trying to go to the market. Of course, we're based on the NIST Artificial Intelligence Risk Match framework. And then we engage the stakeholders. We're using the ENISA guidelines on how to achieve trustworthiness by design, because I mentioned that two distinctions that we have there, and also the requirements imposed by the EU legislative instruments. Those are the four pillars that we have under the faith, let's say, trustworthiness assessment framework. And you can see how we're doing that, you know, because we're looking in two phases, the generic threats and then the domain-specific threats for certain domains. Active aging, healthcare, education, industry, robotics, media and transportation. And here come very useful European projects like in active aging, active age, like in healthcare, coming data from pro-cancer and UKM and also Gatekeeper in order to do what is called the cross-fertilization in different domains, because they're connected. And actually, we have made that as a tool that can produce results for the trustworthiness. Of course, you know, there are several things that are missing today, because we have to understand again what trustworthy and give the metrics. And actually, the tools that we provide and the first, they give the metrics. And actually, they are giving the metrics for all the stages of lifestyle, from planning and designing, the collection and processing of data, the training, the validation, verification, the deployment, the production, the operation, and so on. So, closing this presentation, okay, there are a few slides. I'm sorry that I went behind my time that I had available. But, you know, one of the things that we had to include in those models and actually how we're approaching that is how we're approaching the profile of the person that uses this model. And actually, we're using a model which is called the Fox behavioral model to include motivation, ability, and triggering for using those models. And actually, we have created that. One of the things that I have to address, and this is the last slide here, is, you know, we have created something which is called Passport AI. And Passport AI is something that, you know, comes with a model and identifies in the model the data collection process and localization, the data processing pipeline, the training and validation process, and the operation and monitoring of the models. This covers the full life cycle. It comes like a piece of paper with its model, and then you can go to apply the FAIR framework in order to understand what exactly you can extract from that. Of course, you know, there are certain things that we have to conclude when we're developing AI systems. We have to always be aligned with human values and transparency. We have to take care about data privacy and security. We have to understand what we mean by human AI and collaboration. We have to understand that we're compliant under, for the several regulations and standardizations. We have to make awareness of the public and also to estimate the risks and manage the risks. With this, I would like to close my presentation and thank to my lab. I'm presenting the lab here, which is the Med Lab, the Medical Technologies Lab in the University of Vienna, with several activities, including the journal of IEEE, one of the top journals in the biomedical health informatics, and several spin-outs, and then a lot of projects from the European Commission and a very fancy team at the University of Vienna. Thank you very much for your attention.
Time, but if we have one very much pressure question, we can take one. Okay. If not, thank you very much, Professor Fotiadis.
George Dorfner received.
And I would like to invite now our second keynote speaker, Professor Georg Dorfner. Thank you. Oops.
George Dorfner received his master degree from Vienna University of Technology and the PhD degree from Indiana University Bloomington in 1989. Currently, he is associate professor at the Department of Medical Cybernetics and Artificial Intelligence of the University of Vienna and leads the Neural Networks Group at the Austrian Research Institute for Artificial Intelligence. His research interests are neural networks, time series analysis and economic modeling, signal processing, and connectionist models of conceptual development and language.
Okay, thank you very much. Yeah, first of all, I would like to thank the organizers, Maria, Ricardo, the whole organizing team very much for this exceptional honor to be speaking here. I thank the AI voice for introducing me. As you heard, I mean, I've been working with neural networks in AI for quite some time, and so I would like to take the opportunity to take you on a little journey behind the scenes. What's behind those successes of AI? Now, with all the discussion about ChatGPT, we already forgotten that that's only around for a couple of years, and before that already AI was a big discussion point and had big successes. So I would like to get you on this brief journey where we are and why in the end, AI is currently really transforming digital healthcare. So yeah, let me start with a historical overview. AI is not a new idea. It was first created as a term in the 1950s. And when I started my career in the 1980s, AI looked completely different than it looked today. It was more the idea of explicitly programming knowledge and rules, expert systems. So the so-called symbolic area was. So I started work with neural networks. It wasn't considered AI back then. They couldn't publish at an AI conference. And that has turned around completely. So nowadays, AI is practically synonymous with machine learning and almost synonymous with machine learning with the method called neural networks. But neural networks is not a new idea either. It's actually even older than the idea of AI. It dates back to the 1940s and 50s when the first researchers tried to understand with simple mathematical models what our brain is doing, what's happening in a neuron. And as you can see here along the history, there have been several breakthroughs. And the most latest one I would consider as the generative AI with large language models. I started mine like 3 breakthroughs ago. I started my career in the mid-'80s when the so-called multi-layer perceptrons were introduced. As you see also on the citations here, every such breakthrough was accompanied with high praising sentences in the media, saying things like a computer program that learns to speak like a 6-year-old, or perform human activities like seeing, listening. So the question is, I mean, are these always hypes? And then later on, we discover there's not so much to it. Well, it might be true for the 60s and 80s, but I would like to convince you now AI is here to stay, and the latest breakthroughs are really decisive ones, also in healthcare. Yeah, set behind the scenes. So in a nutshell, a neural network is a system that takes inputs like lab values, or whether you do sports activities or not, assigns values to them, like it's called a weight, like in importance, combines them and produces an output, like this patient has a cardiac disease or not. If you do it in a simple way, it's actually a model that has been around for many decades. It's called a linear regression model, and it's actually also what happened in the 90s. All the statisticians stood up and say, hey, you're neural network people, you're doing statistics and you don't even know it, so better get your theory behind it. But the breakthrough was that if you don't do it in just one step, but here, like it is, on the right, in several steps, like you let the network learn new features in between and then make the decision, that was proven to be much more powerful, and many more things could be learned. And so you can do in medicine, you can do interesting things with this, like prediction models. So this is an example of our own work. We tried to predict the mortality after a patient with cardiac arrest has arrived at the hospital. We can predict, not perfectly, but predict pretty well. So if you predict a probability of 70% survival, then in a validation set, really pretty close to 70% of all the patients who had that prediction did survive. But the surprising thing is, if you look at those prediction models, in very many cases, the majority of the cases, the linear model, the classical statistical model wins. So the question arises, is machine learning really that much better? It was proven to be much more powerful, but we cannot get better predictions. It's still medically very useful, but one has to question why machine learning, why not just statistics? The breakthrough came that really proved that this neural network can do much more than just the classical statistical model, came with the so-called deep learning. So take really this idea seriously. You learn, you have your inputs, your originals, then you learn new features from that, and then you continue. You learn more abstract features, more features, and then in the end you make your final decision. And that turned out, it really works very well when your input per se is still very uninformative, like a pixel in a picture. What does one pixel tell us about whether there's a tumor or not? Not much. But the pixels have a relationship to each other, so they form little features, and this idea of coming from simple to more abstract with better features really lends itself here and so, not surprisingly, those deep neural networks were very successful when the input was an image, for instance, or a signal, a cardiogram or an electroencephalogram. And the additional idea was, okay, when we learn features from pixels, for instance, the features usually are restricted to a certain area, not in a huge picture, not the pixel up there and the pixel down there. They don't have any relationship with each other, but pixels very close to each other. So the idea was not to take the whole picture as an input, but only a certain area, and then you move that area over the whole image. And since mathematically this is called convolution, this led to the name of convolutional neural network, and that was finally started like 10 or more years ago to be really successful. A method where you can finally learn to categorize, to classify, to recognize images way better than we could do it before. So actually, some people called it like it went from feature engineering, so try to find characteristic variables that describe a picture to feature learning, and that was the real breakthrough. So prototypical example, This was published in 2018. It's not our work but in Nature, but that has become the prototypical example, recognizing malignant melanoma from photographic pictures of lesions of the skin. And here on the left, you see the so-called ROC curves. That's the way we usually measure performance of such systems. It's a graph that is actually the x-axis is sensitivity. How many of the melanoma do we really recognize? And the y-axis is the specificity. So how many of the benign ones do we recognize as benign and not malignant melanoma? And the corner in each of the graph, the right upper corner would be perfect. We recognize everything. You see, the graph doesn't reach that. So nothing is perfect in medicine, but neither are the experts, the humans. So you see in those graphs, the blue line is how well the neural network performs. All the red dots and the green ones are the experienced dermatologists. They're all within the curve. They're also not perfect. They're not in that right upper corner, so they make mistakes, but their performance is at least reached, if not superseded by the neural network. So in a nutshell, we can say the neural network, by this way, is proven to be at least as good as an experienced dermatologist. And that wasn't possible before. Convolutional neural networks have really contributed to that. There's another example in radiology. A lot of applications, you have a lot of images in radiology. This is from our own work where we worked with cardiologists who wanted to recognize a disease called cardiac amyloidosis, or there's a type of cardiac amyloidosis from MR pictures, magnetic resonance pictures of the heart. And again, you see those curves, not perfect, but very, very well. And here we cannot compare to experts because there are no experts who can recognize that disease by looking at the image. So you see, that allows us to widen the applications, also to use input that is normally not used in medicine for detecting a certain disease. Another image, another example, not from our own work, in rheumatology, just to show you that it's not just classifying image. Yes, this is pathological, this is normal, but also trying to find areas in the image where there's some pathological, in this case, some incidence of arthritis, and the extent of which you can see it in this picture. This is, again, is from some work we have done at the Medical University of Vienna that shows you, I mean, you can continue with this idea of the neural network. So the end doesn't need to be a classification. You can go back into creating images again. So here we're already coming close to what is called generative AI. In this case, we can use the neural network to learn in a microscopic picture in pathology to recognize every single cell and the nuclei of that cell. And the image that it creates is like a map. It's identifying here's a nucleus, and so on. So we go well beyond just classifying, and that's the power, the increasing power of those networks. Dimitris already mentioned FDA-cleared systems. If you look at the statistics from which medical areas such approved AI systems come, you see it's more than 3/4 radiology, because that's really where all the images are. The second most is cardiology. The other areas are still underrepresented, but basically wherever you have images or signals, these breakthroughs and neural networks can lead to also approved systems that are of help in clinical practice. So I entitled my talk, Empowering Physicians and Patients. So with these convolutional neural networks and the like, we already empowering physicians very much. I mean, they have, in a sense, they get access to medical knowledge, interpreting an image and finding something malignant, a tumor or whatever, when they usually might not have had that experience. So you can sort of like have the same diagnostic performance in every clinic around the world, even if there are no such experienced experts around. That should lead to saving valuable time, so the medical personnel should spend much less time on looking at the images and the signals, should have more time for patients and shift their focus of attention more to dealing with the patient. That will be also my major punchline, and I say should because it's not really always happening that, and so I'm fighting hard to say, okay, physicians should recognize once they have tools at hand like this, they can shift their focus of their activity. But at the same time, we're also empowering patients in a sense that, for instance, now take the example of the melanoma. There are a bunch of apps already around that I can have on my cell phone. I take pictures of my own little lesions on the skin and have a very quick first indication of whether there's something suspicious or whether everything's normal. So I don't have to wait for an appointment for that dermatologist and have my body inspected. I can do it myself, and that's certainly some kind of empowerment. And also, they can expect more constant quality in the future. If every clinic starts using those tools, it will be the same level of diagnostic performance. And I think patients should have the right to the newest technology. Once it's proven, and I showed you how we can prove it with validation and those ROC curves, then I think it should be used wherever it's indicated. But I shouldn't of course hide the negative, the downsides. It's always every advantage also comes with big disadvantages. So people already have also looked into this and said, well, the downside might be that if everybody starts classifying their own skin lesions and there's some false positives, then all our clinics will be swamped by people say, hey, I discovered something, can you? So we will have to fine tune and see how we best apply it in clinical practice. Now comes the next breakthrough, and that is what is now embodied mainly to things like ChatGPT and similar things. That's under the keyword generative AI. It started with so-called large language models. So again, let me quickly say in a nutshell, I mean, the technology is still the same. It's a neural network that learns those weights. It's a huge one, but the difference to before, the inputs are not images, but it's a sequence. It's like a sequence of words in a text, and the output is also a sequence. So basically, the large language model, in the first instantiation, does little more, quote unquote, than taking an input, a text, and predicting the next. So if you see computational sleep score from blah, 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 what's the next word? Time series. What's then the next word? What's then the next word? And so on. And once it has learned, it can produce sentences. You can give it a little snippet, multimodal sleep scoring has, and it will predict, okay, after has, achieved, been, and reached are the most likely words. They have probabilities attached. You pick one, and then your input is the new sentence with that word you picked. And again, you can predict what's the most likely words here. And the surprising thing here is, I mean, yeah, I'll skip the images. Actually, I'm not so impressed, actually, I have to say, about generative AI that creates images. It's fun, but it's not really of medical use yet. So let me come back to the large language model that I just described. So the really surprising success of something like ChatGPT was that although it was trained only on language, when I say only, no other modality, I mean, it was, of course, trained on a huge amount of language. So they basically took every text they could find on the internet. But despite being only a language model, it is capable, seemingly, of making intelligent conversation, creating perfect language, and seemingly deducing also knowledge. But we have to remember, the knowledge that it creates, if we ask it a question, is only the one that is implicitly reflected in the language that it has seen. So some people call a large language model something like an extremely intelligent parrot. It has been sitting next to people talking and has learned to imitate what they're saying, and that imitation sounds like perfect language. But in fact, I mean, I know there are people who disagree here, but I would say that large language model has no idea what it's talking about. It's just saying something, and it has no other experience. It doesn't see anything, it doesn't hear anything, it doesn't feel anything that what we humans do when we deal with language. And therefore, it's not surprising that it's, as we call it, hallucinates often, that it creates something that is perfect language, but doesn't make sense meaning-wise because it seems to invent things. So the basic message is we can use it really surprisingly for many interesting applications, but we need to check. We need to always see, to verify whether what the output is really true, is true knowledge or not. What can we use it for? I mean, ChatGPT was proven to pass the United States medical license examination. That's the test that every doctor has to pass if they want to, I mean, every graduated doctor when they want to practice in the United States. It's very complex questions they have to answer, and ChatGPT, the latest versions, get about 70 to 80% correct, if not more, and that would be sufficient for being allowed to practice in the United States. So what you see, the knowledge, the medical knowledge that at least implicitly the model contains is to a certain level of degree, I mean, really useful, and so it can be used. It can be used to consult the system medically, to get some output, and but we have to keep in mind hallucinations can occur. The next step is already and will be, so that will likely lead to the next big breakthrough, is when you now combine large language models with other modalities, like what we learned about images before, radiology, dermatology, you combine it with the language, and then it might get really powerful because now you at least have a sensory modality. So the language model takes a first step into quote-unquote knowing what it's talking about. So it talks about something that is also reflected in an image. Like you ask what's seen in this image here, and it starts explaining, and without even me wanting it, it starts diagnosing it. So I think really that we will wait. We will up for some new surprises once such models are really trained, not just on language alone, but on many other modalities as well. And so they will most surely, certainly become tools that, again, empower. I start here with the patient. So, I mean, ever since internet was introduced, people have started to diagnose themselves by looking up. We called it Dr. Google. Now we call it Dr. ChatGPT or something else. So most certainly, most people, I admit, including myself, sometimes I have a symptom and I'm curious, I type it in, what could this be? We'll start consulting it. So the physicians will need to be ready that patients come and say, hey, ChatGPT told me this, can you verify that? The advantage is it's consultancy in complete privacy. Well, perhaps not. We are all afraid that OpenAI is collecting all our data, so perhaps it's not totally private, but aside from that, we're not talking to a human, so we don't have to be ashamed of saying anything, so we can be as honest as nobody would be in front of a person. But it will also empower physicians. I mean, physicians starting to recognize that, again, the implicit knowledge that's contained in such models is really valuable also for a trained physician, because you take, I mean, ChatGPT or other models have seen, or in theory could have seen as many, like 1,000 times as many papers that any of us can read during our lifetimes. So just consider what the value of that resource could be if we have access to so much knowledge. So I'm pretty sure that also physicians will recognize that it will help them to get an opinion, like a first opinion, but like with the hallucinations, they will still need their knowledge, so it won't replace the need for the physician. They will need to be there to check, to verify whether what's output by the model can really be true, or whether it is a so-called hallucination. So in summary, I would like to say, yes, there's quite a wide range of applications in healthcare of AI. I showed the examples of diagnostic systems. AI can be used in health monitoring. We all have our wearable systems and record our own data, and AI can help make sense of it. but there's also a lot of success and progress in research, like so-called AlphaFold. The protein folding problem is solved today on a completely different level as before, and helps find in drug research and so on. So also medical research benefits a lot from AI. Can we trust? Also, we heard already about trustworthy. I said, yes, we have ways of statistically validating, and once we have proven in a certain range that the performance is acceptable in the sense that it's as good as human performance, we can trust it, I think. So, but the question I would like to finally address is, and I gave the answer already a little bit, is medical doctors, that a profession is in danger. Will soon AI be replacing medical doctors? And if you look at the popular media, you might get the impression, everywhere AI in medicine, pictures pop up with robots instead of humans. And here, I would say, no, definitely no, AI will and should not replace medical doctors, but it will mean that the medical doctors, and I said that already, will have to change their focus of what they're doing. I've said for a long time, well, one capability of a doctor is to show empathy, to communicate with the patient. Then this study came along. There were answers to medical questions presented blindly to participants. Some of them came from doctors, some of them came from ChatGPT. And ChatGPT won by a large margin in both what is most informative and what is most empathetic, shows the most empathy. And that was surprising too, another warning sign. Okay, you need to change your habit. I mean, one of the reasons why ChatGPT is seen to be have more empathy is that the answers are much more elaborate and seemingly go more into the addressing the patient and explaining it really to them. So I think a lot of doctors will have to change. Whether we will ever have artificial general intelligence, the next few years will show, but I think AI will contribute to a new understanding of the role of the physician. So we have those AI systems as tools, and the doctors will still be there with their medical knowledge to first check and bring the information together, verify is everything from the AI really correct, or how can we combine that, and to communicate. I mean, the contact with the patient will become ever more important. And the situation today is that already some physicians, I think, start realizing it, not everybody yet, but we also, on the other hand, unfortunately see signs that perhaps the whole field might go in the wrong direction meaning the human is out of the loop. If we see machines like this in the States, where basically you go to Walmart, type in your symptoms, and you get your prescription, I think the patient should have the right to talk to a human, even if it's just about a common cold. So we should fight to keep the human in the loop despite all the powerful AI. And with this, I would like to finish. I think the time has progressed already well, and thank you very much for your attention.
Yes, time is running very short, but again, if we have any pressure question. If not, thank you very much for the great talk. And yeah, we have now coffee break. It will be a shorter one than normal. We will back at 11 to the sessions, okay? Thank you very much for your attention.